Hello friends, welcome back to our channel Lab Learnings. Today we are going to talk and discuss about AMH, which is anti-Mullerian hormone. Now what is AMH? Basically it's a marker for gonads, that is ovaries. It gives the potential of ovarian reserve for reproduction. Unlike markers like E2, which is estrogen, FSH, LH, which were used a decade ago to assess the ovulation and the ovarian reserve, AMH is basically an independent marker. It does not vary with the menstrual cycle or the day of ovulation. Now, AMH has various uses. One most important is obviously, as I said, ovarian reserve. It is like it gives us the idea about the antral follicular count. For layman, it is like to estimate the fixed deposit of your ovaries as to how many eggs are there in the ovary. Very, very important, particularly with the rise in infertility and IVFs, and basically consultants need to know what are they looking at. Number two is with young women undergoing PCOS or PCOS like condition, because in that the AMH count is high or elevated. Number three is premature ovarian failure, where we have seen counts going down up to 0.3 or lesser than 0.3. And most important is early onset of menopause or pre-menopause, where AMH levels are very low. So what is the take home for us in AMH? AMH is a wonderful assay. It's available on automated platforms. The results can be available in 3 to 4 hours. Very, very precise, does not vary with the cycle. Very stable marker. And once the clinician knows that the AMH is below a particular value, there are various reference ranges. You will see the reference range which we follow. Depending on that, the cutoff for the clinician is, if the value is say below 0.9, then that particular couple is taken for a different procedure instead of just IVF. Okay, so it is a precise marker. It is an excellent marker for ovarian reserve and can give wonderful results. So other markers along with AMH are E2, FSH, LH and Inhibin. Inhibin is again a very robust marker for ovarian fertility potential. Antral follicle count of ovary and AMH, as I said, is a correlation for evaluating fertility potential. So if we see a young couple or a couple who is consulting for conception, AMH values, as I said, evaluate the potential. So if the value is low, say for example, if the value is 0.9, say below 1.2 or below 1, then these couples are considered as poor responders. Then what are the options? The options are definitely done with clinical consultation, and obviously the couple investigation is taken into account. There are some conditions where there is endometriosis or PCOS overlying these conditions, which can be treated, and a repeat AMH can be done post that and evaluated. Other options are taking a donor egg or surrogacy. That is taken in consultation with the clinical evaluation and correlation. Most important is, as I said, premature ovarian failure or premature menopause onset. In that also we are seeing younger females around the age of 40 and 42 come to us with an AMH value of less than 0.3, which is absolutely lowest fertility potential. In that, again, in consultation with the couple, the options like a donor egg or surrogacy can be considered. So the take home here is AMH is a wonderful test. As I said, it can give us the analysis of how many eggs, antral follicle count means how many eggs are there in the ovary. It will give an estimate of the fertility potential. Other conditions like PCOS or ovarian failure or onset of menopause can be diagnosed. Sometimes in rare cases, we have also seen in younger children, AMH is used to check the gonadal status. I mean, whether there are ovaries, in younger babies. It's used to analyze the gonadal state of the child. So friends, with this, we end today's topic, AMH, anti-Mullerian hormone. If you like the content of this channel, Lab Learnings, please subscribe to our channel. So we look forward to your comments and suggestions. Till then, stay safe, stay healthy.